Afghanistan is entering the harsh winter amid a deepening humanitarian crisis, with millions of people struggling to survive due to widespread poverty, dwindling international aid, and rising hunger. The United Nations World Food Programme warns that, for the first time in decades, it cannot mount an effective winter response, leaving vulnerable families, especially children, at grave risk. A report.
After more than 4 decades of conflict, Afghanistan remains one of the world's poorest and most fragile countries, with much of its population dependent on humanitarian assistance to survive. Years of war have devastated infrastructure, weakened public services, and left millions without stable livelihoods. Since the 2021 withdrawal of US-led forces and the return of the Taliban to power, international assistance has dropped sharply. The loss of foreign aid and development funding has triggered a severe economic downturn, pushing millions of Afghans deeper into poverty and leaving families with few ways to earn a sustainable income. This winter, already difficult living conditions are being further strained by soaring food prices, widespread unemployment, and the lingering effects of drought and earthquakes that have damaged homes, farmland, and water supplies. Many rural communities have seen harvests fail, while urban families struggle to afford even basic staples. For households trying to meet their most basic needs, heating, nutritious food, and healthcare have become impossible luxuries. Parents are often forced to make painful choices between buying food or fuel, delaying medical treatment, or pulling children out of school, decisions that carry long-term consequences, especially for young children and the elderly.
ژمي سختې زموږ دپاره خسو وسم نشته چې خس واخلو دا هم ماشومه ده وسم نه کېږي بس همدومره راوړي چې ویې خورو که چا راکړه خو سوځو یا ګنې ناست یو بخارۍ ته ایستم وس نه کېږي.
The United Nations World Food Programme says malnutrition in Afghanistan has reached its highest level in decades, with children suffering the most. Aid workers warn that growing numbers of infants and young children are now severely undernourished, leaving them highly vulnerable to disease. Severe funding cuts have forced the agency to scale back or suspend food assistance to millions of people, even as winter temperatures set in and nutritional needs increase. Many families who once relied on regular food support are now being left without help. Child deaths are expected to rise during Afghanistan's winter months, when food is scarcest and access to healthcare becomes more limited. The World Food Programme estimates that 17 million people are currently facing acute hunger, around 3 million more than last year. The crisis has been further intensified by the mass return of Afghans from neighboring Iran and Pakistan under migrant and refugee return programs, adding new pressure to already struggling households and communities.
Soaring malnutrition is now placing the lives of millions of children at risk. We've seen dramatic aid cuts and cuts to food assistance, and the poorest Afghans are now asking themselves, how are we going to make it through the winter? Forced returns of Afghans from neighbouring countries, widespread drought, and a dramatic decline in food assistance across the country have created a devastating hunger crisis now affecting 17 million people.
Without significant and sustained international support, Afghanistan's humanitarian crisis could have long-term consequences for the country's future. Widespread malnutrition and poverty threaten the health, education, and development of an entire generation of children, while economic collapse and displacement make recovery increasingly difficult. Aid groups stress that rebuilding livelihoods, strengthening communities, and restoring access to basic services will be essential if Afghanistan hopes to break the cycle of hunger and instability. Otherwise, millions of Afghans may continue to face uncertainty and hardship for years to come.